It's the appointed time. We have a quorum. This is a meeting with the Labor and Welfare Bureau and the Home and Youth Affairs Bureau. This is a policy briefing to give members a deeper understanding of the government's policy making. We are grateful to the Secretary for Labor and Welfare and also the Undersecretary for Home and Youth Affairs for holding this policy briefing session for members on their respective policy portfolios. So first, the Secretary for Labor and Welfare, Mr. Chris Sun, will speak. He will brief us on CB bracket 136/2026 bracket 01. Mr. Sun will make a speech with the aid of slides, and then Mr. Clarence Leung will also brief us on paper CB bracket 136/2026 bracket 02. Members who would like to speak, please press the request to speak button now. I will look at the lineup and then I will decide on the time limit for each member. Over to you, Mr. Chris Sun. Thank you, Chairman. I'm pleased to be here to brief members on our highlights on social welfare. So here's what we will do. Welfare covers a wide range of areas. So I will spend roughly 40 minutes on that, and then Mr. Clarence Leung will spend a few minutes to discuss social enterprises and the community care fund, and then we will open the floor for questions and comments. Chairman, as you are well aware, for social welfare, as you can see, our goal is to build a caring and inclusive society and promoting the well-being of the underprivileged. We start at the top level. We look at the government expenditure. Over the past few years, our spending on welfare has grown substantially, and that's clearly shown in the chart. In 2021, the recurrent expenditure on social welfare was $88.9 billion, just shy of $90 billion. By 2025 to 26, it was at $130.4 billion. Welfare spending trumped all other areas in government expenditure. Our society is aging, and that means a lot of spending on welfare. In a moment, my permanent secretary will discuss targeted poverty alleviation, and then the social welfare department will tell members about the major areas of work under the SWD. I now give the floor to my permanent secretary. Over to you, permanent secretary. Thank you. First, I want to start with targeted poverty relief. Poverty relief is top of mind for the government. Our existing mechanism is that we have a commission on poverty. And that commission is led by the Chief Secretary for Administration. That shows the importance we attach to poverty relief. It also shows that targeted poverty relief covers a wide range of areas. That's why you need cross-bureau, cross-departmental collaboration. At the community level, we also need the input of stakeholders. As members will recall, in the past, the poverty line featured in our poverty relief efforts, but we do realize there are many limitations to the poverty line. That line is based on household income as the sole indicator without regard for a person's assets. Our support measures were also too focused on cash assistance without much regard for the effectiveness of lifting people out of poverty. We also relied on the concept of relative poverty. So no matter how much effort went into the work, based on that definition, you will always end up with an impoverished population. So under that approach, in the long run, that held us back in terms of our poverty relief and monitoring progress. So now we adopt this targeted poverty alleviation approach. This means our resources go to people most in need in the community. We look at the needs of different demographic groups. Some people can stand on their own feet, so we empower these people so that they can stand on their own feet. Now, for those people who need more help, we have social welfare to offer a safety net. On the advice of the Commission on Poverty, the current government has analyzed the needs and traits of different demographic groups. So we take a multi-pronged approach. We consider the family composition and also employment of different people. We also consider whether people are already on any kind of cash assistance and also living conditions. We take all these factors into account and then arrive at the groups most in need under targeted poverty relief. This means we want to help people at the very end of the queue, meaning those most in need. So we have identified the following groups: subdivided unit residents, single-parent households, and all elderly households. And then we also take a tripartite approach involving the government, the community, and businesses to launch a series of targeted measures. Now I want to spend some time on these initiatives. First, community living rooms. These living rooms are shared living spaces for residents of subdivided units. That's to make up for the cramped living space these people are stuck with. Some members may have visited CLRs. At one of these living rooms, you will find laundry facilities, shared kitchens, shower areas, space for learning and playing games, as well as area for socializing. The point about these at CLRs is to offer greater living space for users. More importantly, we want to strengthen the connection of these people with the community. We want to improve their living standard and enhance their sense of well-being and sense of belonging. CLRs represent a tripartite initiative involving the government, businesses, and the community. The venues of CLRs are provided by businesses rent-free. They also provide the fitting out. The maintenance costs are borne by the Community Caring Fund. And then the running will be performed by social welfare organizations. The first CLR was launched in December 2022. The scheme was well received. By now, we have 9 community living rooms. Now we have been serving way more SDU households and people than expected. We will open a few new CLRs. This year we will get 6 extra CLRs, along with those already in operation. Altogether, we will have 15 such CLRs in total by the end of this year, and we will be able to cover 7,000 SDU households, covering 1.4 million attendances. The second effort, also very popular, is the school-based after-school care services scheme. This scheme started in the school year 2023 to 24. Schools provide the venue. That's why it's called a school-based scheme. NGOs run the scheme. The operating expenses are met by the CCF. The target of this scheme is primary students in need. After classes, they can stay at school for after-school care and also learning support. The support will benefit the students and will also make it easier for the students' parents to work. Otherwise, stay-at-home parents are now able to take up part-time work or even full-time work. And that will mean more income for those families and improvement to the quality of life of those families. After the scheme is running, we realize there is an improvement to the quality of life in families, especially for single-parent families. So after the scheme was launched, more and more schools joined the scheme, as you can see on the slide. Starting from the 2025 to 26 school year, we have removed the cap on service places. We have now recruited over 200 primary schools, offering roughly 10,000 places. In the future, we will encourage more primary schools to sign up, and then we will be able to cover more students and their parents. The third project is something you will have heard often, and that's the Strive and Rise program. This involves businesses and other institutions. They give to the program. They also recruit voluntary mentors for us. The government meets the administrative expenses. We identify NGOs to help out. This program targets children from underprivileged families, especially secondary school students from subdivided units. There are three aspects to the program. First, we match students with mentors. Second, we also lay down a personal development plan for each trainee. At the end of each cohort, each student gets financial assistance in terms of matching students with mentors and also holding activities as well as interactions with mentors and group activities. Now we also do mainland exchange tours. All these activities broaden horizons of these students. We strengthen their self-confidence so that these students can lay down goals for themselves in the future and they can move up the social ladder. The end goal is to lift them out of intergenerational poverty. So far, we're at the fourth cohort of Strive and Rise, and every student who has completed the program becomes a member of the alumni club. So far, we have helped 14,000 secondary school students. The last project is the Child Development Fund. You can think of the CDF as the precursor to Strive and Rise. The CDF looks after senior primary students from underprivileged families, whereas Strive and Rise is for secondary school students. Now, for the CDF, again, this involves the government, businesses, and the community. Funding goes to NGOs and also schools. There are two categories under the CDF. Primary school students get mentors, and they also join activities. That's to help primary school students find their goals, and then they can move towards that direction. The CDF was launched in 2008. By now, the government has injected over $1 billion into the scheme. More than 350 funded activities have been held, covering more than 30,000 grassroots students to ensure the sustainability of the CDF. The 2025 policy address announced another $180 million into the fund. Starting from the next financial year, there will be more activities so that we can cover another 54,000 pupils. At our meeting in early February, we will brief this panel specifically on the measures for the CDF. We're also learning from the successful experience of Strive and Rise. That means we will be offering new initiatives under the CDF. So that students learn more about social responsibility and protecting the environment. In the middle of this year, the Commission on Poverty will release a report on the results of our targeted poverty relief efforts. That report will elaborate on what I have discussed so far about poverty relief. That report will also give you an overview of the government's measures in lifting people out of poverty and preventing people from falling into poverty. And now I give the floor to the Director of Social Welfare.
Thank you. I'd like to talk about the role of the SWD. We are responsible for implementing the social welfare policies of the administration. We coordinate all the services throughout the city. We also provide different subsidies and services. We build an inclusive and caring society in Hong Kong. There are three main policy portfolios of the SWD. First of all, we are a service provider. Some of the services are statutory services. The SWD is responsible for implementing the three targeted poverty measures. We also provide integrated family services, family and child protective services, and medical social services. As you can see, we also provide clinical psychological services as well as emergency support. I'm going to go into more details about these two aspects. Regarding resource manager and allocator, this is also one of our roles. As the Secretary mentioned, the funding for social welfare is substantial every year. Social Security, that is CSSA, recurrent subvention. There are a total of 170 subvented organizations, Lauders Fund and dedicated funds. There are also two types of service voucher, that is community care service voucher for the elderly and residential care service voucher for the elderly. The SWD is responsible for managing and distributing these vouchers. At the same time, the SWD is also a regulator. We are responsible for monitoring and maintaining the quality of subvented services. We license and regulate residential care homes, and we also regulate charitable fundraising activities. Moving on to the next slide. As we mentioned just now, subvented organizations provide SWD services. If we can enhance the quality of these organizations, the service quality will also improve. This will enable us to provide more targeted services to those in need. The department has done a lot to improve the quality of the sector, thereby fostering their development. I'd like to talk about measures to reduce red tape. In the budget of the previous 2 years, PEP was implemented for 2 years in a row. The combined adjustment figures will be reduced by about 7% in 2027 to 28. Together with the industry, we implement the PEP, that is the Productivity Enhancement Program. The LWB has already sorted out the priorities. And together with the sector, we reduce administrative burden in handling cost apportionment. From the administrative perspective, we have implemented a number of support measures. We aim to reduce administrative burden, handle cost management, and we also refine funding and service agreements. So what does cost apportionment really mean? Organizations are responsible for providing different social welfare services. We have taken into account the views provided by organizations. We have reviewed the situation as well. We found that there was room to enhance administrative efficiency. Manpower, venue, facilities, all these could be used in a more flexible manner. Synergy could be improved. There are a total of 38 designated measures. If organizations engage in these initiatives, then there is no need for cost apportionment, and this will greatly reduce time taken. And we are also refining funding and service agreements. There is an increase in the number of funding and service agreements. We have already identified room, as we said, to improve the situation. For example, we can streamline the agreements. For key performance indicators, there is also room for better refinement. Some organizations have already received streamlined and simplified funding and service agreements. Within organizations, there are actually benefits. We can more efficiently carry out tasks with simplified agreements and procedures. The response for streamlined procedures has been good. We will maintain a close dialogue with social welfare organizations. We hope to roll out even more measures to streamline administrative procedures and enhance administrative efficiency. Regarding the dedicated fund, in a policy address 2023, the chief executive announced the injection of $500 million. The aim is to support NGOs operating subvented welfare services to provide staff training and implement system enhancement. We aim to enhance professional collaboration as well as the use of information technology. There are several parts to the fund. One, institution-based support, that is staff training, system upgrade, and so on. In addition, the fund can also be put to meaningful use, including national studies and overseas study tours. We can work hand in hand with social welfare organizations or units in the Chinese mainland. Having regard to the situation every year, we propose some themes. For example, in this year, that is 2026, for child abuse cases, we have provided courses in this regard. That is to tie in with the implementation of the mandatory reporting of child abuse ordinance. We also provide courses on carer support, cybersecurity, data security, and so on. As at the end of December last year, a total of 460 projects have been approved involving a total of $80 million of funding. We'll continue to work hard on publicity. We'll continue to promote this fund in the hope that organizations will make good use of the fund to improve the efficiency of their work. Last of all, I'd like to speak on emergency support. When typhoon struck Hong Kong, and when residents needed to be evacuated due to a bomb, the one social worker per household special support initiative was very effective. There was a blaze that took place in Wang Fok Court in Tai Po. At that time, we implemented this policy, and I have to emphasize that is one social worker per household. The SWD assigned a dedicated social worker to each affected household with priority in handling their social welfare and related needs. We provided full support to the government. A total of 1,960 households were involved. One social worker is teamed up with 2 to 3 civil servants. We aim to provide one-stop services to the affected residents. In addition to grief and psychological support, the SWD is also involved in the coordination of aid or fund support under government departments and NGOs. For instance, we have taken part in the long-term housing questionnaire sent to residents of Wang Fok Court. We also assisted residents with housing arrangements, and we disseminated various information as well. We want to spare residents the hassle of getting information from different sources. Members of the Council discussed the one social worker per household in great detail in the motion debate at the Council meeting on the 14th of January, will continue to provide well-rounded support for the affected residents. Now I'd like to give the floor to Mrs. Winnie Kang Lang to we are going to give the floor to Ms. Maggie Leung to brief members on social welfare services. First of all, the mandatory reporting of child abuse ordinance was gazetted and it came into effect on the 20th of January, that is last week. To tie in with the implementation of the ordinance, the government has rolled out a series of supportive measures. First of all, 2 new residential childcare centers were added. That is to cater for the possible increase in the number of child abuse cases reported under the mandatory reporting of child abuse ordinance. We have added 2 more centers. They are in Tuen Mun and Kwun Tong. For the one in Tuen Mun, it was commissioned in December last year. As for the one in Kwun Tong, it came into operation in December last year as well. An additional 96 places could be provided. So in Kowloon, in the NT, and on Hong Kong Island, there are also residential childcare services centers. In March 2025, 6 child protection support service teams were established. Some parents actually need guidance and assistance when it comes to providing for and taking care of their children. So we have a team of professionals, including nurses, psychologists, and so on, to provide assistance. We target high-risk children. And then we step in and we provide services. Starting from March last year, all the way to September, that is within a 6-month period, the 6 child protection support service teams have handled a total of 428 cases. We can all see the results of these services. Some parents were able to take care of their children better so that they won't break the law inadvertently. We work with the education sector, the public healthcare sector, and the social welfare sector to lay the groundwork for the implementation of the ordinance, including holding seminars in September last year. And starting from September, we have held a total of 20 seminars. We saw an attendance of a total of 18,000 participants. As for the guide, it was published in July 2025. It covered the flowchart, the analytical framework, and case management scenarios. We aim to assist professionals in identifying serious child abuse cases. In addition to online courses, an electronic decision tree was published. We encourage everyone in society to make reports online.
On the e-learning courses on child protection, more than 2.4 million logins were recorded. Now on the e-decision tree, our decision tree is the first bilingual one in Chinese and English across the world. That's to help professionals to make a decision. On public education and promotion, we have also done much in preparation. At the community, school, and family level, we have promoted the mandatory reporting regime. We have also raised child protection awareness. In different parts of the community, you may also be aware that in places like community halls, sports centers, and on public transport, you can see the ads and also banners promoting the ordinance. We have also held different events to promote child protection messages, and that also includes messages for members from ethnic minorities. Now that the ordinance is in effect, we will keep promoting the child protection message, and we will also make sure the measures we adopt are effective. Now I turn to child and youth welfare services. There are now 139 integrated child and youth services centers. This is for those aged 6 to 24. Last year, we worked with the sector on a review of the services. On the mental health of children and youth, we have redoubled our effort. We've also looked at marginal youth and at-risk youth. We want to step up the role of these centers. We also have district-based centers for children and youth. Altogether, there are 22 such centers across the city. Those centers hold events and offer counseling to children and youth. And then there are also residential childcare services. Now, for daycare child services, women want to work, so these centers come in handy. These centers offer day childcare to support working families. In the future, we will offer more places at day childcare centers. Our goal is to increase those places by 1,500 in a few years' time. And we're also working to increase the number of places under the home-based childcare scheme. Now, more than 20,000 people have been served under this scheme, and we will keep stepping up the services. On family welfare services, members may be more familiar with these services. There are now 65 integrated family service centers. These services come at 3 levels: prevention, support, and remedy. That's to shore up the function played by families. Across the city, there are 11 family and child protective services units. These units handle domestic violence, child abuse, and child custody or guardianship dispute cases. Enforcing the regime about mandatory reporting of child abuse is done by these FCPSUs. Now, for separated parents or parents working on their divorce, there are 5 specialized co-parenting support centers. These centers provide support on parenting activities and visits to children. In the second quarter of this year, we will set up 4 community parents and children centers. These centers will focus on games as a way to promote parenting, and this will foster positive parenting education. On looking after seniors, the government approach is aging in place as the core. We have launched different measures under this approach. There are home visits, and then we also have daycare centers for seniors. That's for seniors in the community. We also have elderly centers. They are district elderly community centers and also neighborhood elderly centers. Now there are 41 DECCs and 174 NECs. These centers provide community support services. For seniors in need of care, we have launched service vouchers, and they include community care service vouchers and also residential care service vouchers. Seniors go through the standardized care needs assessment mechanism, and once they are determined to require care, they are put on a waiting list, and they will be able to access these vouchers. The principle is that the money will follow the user, meaning the seniors can find the services and service models that suit their needs. Last year, the policy address proposed a new measure. This year, there will be an extra 4,000 community care service vouchers. Altogether, there will be 16,000 such vouchers. As for residential care service vouchers, there will be an extra 1,000 vouchers. Altogether, there will be 7,000 such vouchers. Now I want to turn to the residential care services scheme in Guangdong. This scheme has been running for 2 years. Now, 24 care homes in Guangdong are covered. They are found in 8 cities of the Guangdong GBA, and they are in Guangdong, Zhuhai, Shenzhen, Huizhou, and other cities, altogether 8 cities. As at the end of December last year, 890 seniors were staying at mainland care homes through this scheme. We have also launched other support measures. In May 2025, we offered social and care support services. For seniors who decided to stay in those Guangdong care homes, we offered support in the first 6 months of their stay. In December last year, we also launched a pilot medical subsidy arrangement. This arrangement will last for 2 years. That's to cover the healthcare expenses of seniors. This is to allay their concerns about their healthcare bills. Under the National Basic Medical Insurance Policy, seniors going to designated medical institutions will be eligible for up to 10,000 RMB per person for outpatient clinic expenses and also 30,000 RMB per person for inpatient expenses. We will keep in view the result of this arrangement. For persons with disabilities, we also have a range of measures on this front. There are different kinds of disabilities, and these people come in different age groups. We provide different services based on these different traits. There are preschool rehabilitation services, there are vocational rehabilitation, residential care, community support, financial assistance, etc. I want to highlight support for carers in particular. Now, there are parents and relatives resource centers. That's to support the parents and their relatives. There will be more places under different services. We will also launch more support for seniors with disabilities. In the second quarter this year, at the hostels for persons with medium or severe disabilities, we will also step up services. There will be extended care. Our goal is to provide an extra 700 places to cover more PWDs. Now for carers, there will be a range of measures that will be launched. Last July, we set up the first phase of the carer support data platform. We linked up the data of the Social Welfare Department, the Hospital Authority, and the Hong Kong Housing Authority. Once the SWD becomes aware of the admission of a carer, the SWD will reach out to the person looked after by this carer. Emergency support will be offered. In the future, we will link up the data of more departments and parties to offer greater support for the carers. The 2025 policy address also proposed accident detection systems for at-risk residents. The idea is to use smart technology to ensure timely assistance for carers who have got an accident at home. Care teams are also involved in supporting carers and seniors. The 3-year scheme will keep running. Care teams will reach out and visit households in need, especially seniors who live alone, or households or senior-only households, as well as households with PWDs and their carers. These visits will help care teams identify households in need, and then the care teams will refer these cases to the SWD for follow-up actions. Care teams will also help these households to install the emergency alarm systems when needed. We will keep running the Support for Carers project, and we will continue to train frontline property management personnel to assist carers in need. On community mental health services, as members are well aware, there are 24 integrated community centers for mental wellness, offering one-stop and district-based community support services. In Tongchong, there will be a new ICCMW. That center is expected to open in March this year. In the first quarter this year, we will regularize the transitional support service for persons in mental recovery. That's to help them navigate their recovery journey. I have covered some support services. We also promote mental health on top of the support. The Labor and Welfare Bureau and the relevant non-government organizations will keep supporting persons in mental recovery. We will hold events such as the Mental Health Month. We organize activities every year to promote mental health. And also we promote acceptance of persons in mental recovery. We will keep working on this, on the public education. And now give the floor to the other Deputy Director for Social Welfare, Ms. Nancy Kwan. The quality of institutional care matters to the government. We take a range of measures to improve the quality of service. In May 2022, the government submitted the Residential Care Home Miscellaneous Amendment Bill 2023. That bill went through deliberations by the Bills Committee, and then in June 2023, the bill was passed and gazetted. As you can see from this slide, there were 8 highlights of this bill. To make sure the people running the care homes have the time to prepare for the implementation of this ordinance, the provisions of the ordinance kicking in phases. Most of the bill have taken effect. They took effect on the 16th of June. As for the minimum floor size requirement and the staffing requirement, those come with longer transitional requirements. Those provisions will take effect in 2026, 2028, 2032, and a date to be specified by the Secretary for Labor and Welfare. Residents of care homes require the care of nurses, health workers, and also health and care work practitioners. Care homes struggle to hire and retain workers, so the 2022 policy address proposed a review of the skills and qualifications of workers at care homes. That's to create professional standards and a career ladder for these workers. In March 2023, the SWD commissioned a consultancy study on this matter. So one recommendation from that review was to create a professional rank of health and care practitioners. These practitioners will offer care at care homes. The HCP is a new professional rank specifically for care homes. That's to attract people looking to start a career in social welfare. HCPs also represent a promotion rank for health workers that will help care homes retain talent. HCPs also provide greater flexibility for care homes in manpower, and this is also to reduce the competition with the healthcare sector for workers. So we will first invite experienced health workers who have no fewer than 3 years under their belt to take part in the training. They have first to complete the course first. They then obtain a professional diploma at QF level 4. Total learning hours 760 hours. The entry requirements are the same as those for enrolled nurses. The assessment criteria are also the same as those for enrolled nurses. Training bodies are now looking at the framework proposed by the consultant, and they're designing the training courses. The first course is expected to be launched in the second half of this year. The recruitment will start. Now the Labor and Welfare Bureau and the SWD are now working on the legislative amendments so that we can incorporate HCPs into our law so that care homes can hire HCPs to meet the staffing requirements under the ordinance.
援助方面呢，
Regarding cash assistance, I'd like to move on to discuss Comprehensive Social Security Assistance Scheme, that is CSSA, and Social Security Allowance Scheme, SSA. These two schemes require no contributions. For the CSSA scheme, it is a protection net for those who cannot fend for themselves. As for the Social Security Allowance Scheme, it targets people aged 65 or above, or for the seriously disabled, allowances are provided. They include old age allowance, OAA, old age living allowance, OALA, and disability allowance. As at the end of November, 790,000 people are receiving old age allowance, accounting for about $43.5 billion. As at the end of November 2025, a total of 1.64 million people are receiving assistance. Now we have the Portable Cash Assistance initiatives that covers the Guangdong scheme and the Fujian scheme under the SSA scheme, as well as the Portable CSSA scheme under the CSSA scheme. This covers OAA, OALA. As at the end of November 25, about 30,000 people living in Guangdong and Fujian were receiving portable cash assistance. The government rolled out enhancement measures regarding the CSSA scheme in order to encourage unemployed, able-bodied recipients to develop a work habit. The program for the unemployed was launched in October 2025. For those aged between 15 and 59, they need to take part in this scheme. They have to engage in unpaid for work in order to gain work experience. Regarding portable cash assistance, in October 2025, a 3-year pilot program was launched to subsidize elderly recipients of CSSA who choose to retire in the Guangdong province to reside in designated GD, that is Guangdong Residential Care Homes for the Elderly, with a quota of 1,000 and a monthly subsidy of $5,000. Money under the portable cash assistance is deposited right into the bank accounts of the recipients by the administration. Right now, we are working together with the ICBC and the Bank of China Hong Kong. We want to let recipients choose which bank accounts they will use to receive the portable cash assistance. We expect to roll out this new service in the middle of 2026. Subject to the approval of the Council, we make adjustments to the rates of the CSSA as well as the Social Security cash assistance with reference to indicators. We have already tabled papers to the Panel on Welfare Services of the Council. We have made recommendations on rate adjustments. We recommend starting from the 1st of February 2026. The standard payment rates under the CSSA scheme and the rates of allowances under the SSA scheme will be increased by 2.2% and 1.3% respectively. We will seek the approval of the Finance Committee as soon as possible. Subject to its approval, we will make arrangements for the disbursement of the rate starting from March this year. Now I will give the floor to my colleague to give you more information on Working Family Allowance Scheme. We aim to ease the financial burden of families in need. We also encourage these families to join the workforce and to fend for themselves. The rate of allowances is determined by the household's working hours, income, and asset levels. The scheme was implemented in April 2018. Since April 2024, the rates of the household and child allowances under the scheme have gone up by 15% across the board. The maximum monthly allowance for each household is $1,610. Each child may receive an extra allowance up to $1,610 per month. For a 4-people household, as an example, the maximum allowance that one can receive is $4,830. The estimated recurrent expenditure in 2025 to 26 is estimated at $2.099 billion. As at the end of November last year, there were about 48,000 active households involving 160,000 people, covering 70,000 teenagers and children. The policy address sets out a pilot arrangement to provide time-limited cash incentives on a pilot basis for households leaving the CSSA scheme and joining the WFA to encourage self-reliance. I now give the floor back to the Secretary. Thank you. Well, perhaps I will give the floor to Mr. Clement Leung to start the briefing under his purview. Thank you. Thank you. I'll be quick. I will speak on two fronts. One, social enterprises and community care fund, CCF. As for social enterprises, they are developing in a stable manner. We work on three main fronts. One, promotion. As you can see, we have the mascot. That is the mascot, it's Bloomy the tree. It appears quite often in our initiatives. We will continue to promote this mascot on our platforms. Next, we promote the development of social enterprises so that they will develop their market adaptability and competitiveness. We will continue to render assistance and support to social enterprises to enhance their training. We want them to improve their own capabilities. The third front is to provide funding support for individual social enterprises. We have a scheme under the HYAB, that is the Enhancing Self-Reliance Through District Partnership Program. It's been launched since 2006. A total of 270 social enterprises projects have been approved. Over 8,000 people have been directly employed under the program. In 2026, looking forward, we will integrate our existing resources so that we will launch the Integrated SE Development Subsidy Scheme in 2026. We aim to provide support on training, support on business development, enhance the capability of social enterprises, and facilitate collaborative development with private organizations. Next, moving on to CCF Community Care Fund. The CCF task force is headed by the Secretary of Labor and Welfare, and the HYAB provides secretarial support for the Community Fund. We take into account the recommendations of the fund. We consider feasibility, draw up detailed proposals, and we identify target beneficiaries. Afterwards, we submit proposals to the task force. Then, the proposals and the programs will be implemented by the relevant bureaus and departments. As at end November 2025, a total of 76 assistance programs have been implemented, aiming to benefit 3.79 million people. 25 programs have been incorporated into government's regular assistance programs or services. We'll continue to review the existing arrangements, and if need be, we will consider making adjustments so that the programs will target beneficiaries in a better manner. That concludes my introduction. Thank you. And I will draw a line here. For those who would like to press the button to request to speak, please do so now. A total of 13 members have requested to speak. We don't have much time left. If need be, I will extend the meeting by a maximum of 15 minutes. Members, please remember, if you want the administration to reply, please give them sufficient time to reply. Otherwise, they won't be able to do so. First member, Professor Chen Wen-Kong. Thank you, Chairman. I believe we have sufficient time to discuss regular matters regarding the portfolio. Regarding the one social worker per household, I support this initiative. It provides targeted support to the affected residents of the Wangford Court fire, and I want to express my gratitude to the tireless support for social workers. Post-disaster relief, counseling, all these are very important. Social welfare workers need to implement these policies, and they also need to be responsible for providing frontline services. So I'd like to know how the department will manage manpower. How can you make sure social welfare workers can cope with the sudden increase in the workload in order that they won't suffer from too much workload? Mr. Christen. Thank you, Professor Chen, for his support. I'd like to ask the director to give you more information. Thank you. I thank Professor Chen for your support. Social welfare workers have a lot on their plate, including the statutory responsibilities. The Wangford Court fire is indeed very serious. A lot of residents were affected, and I thank members for their support for the one social worker per household initiative. There are different stages for our support work. In the first stage, we provide services to the most needed. We disseminate information, we provide resources. For bereaved families, we help them with the identification of bodies and the relevant work. At the first stage, we have already finished it. Moving into the second stage, it's about more long-term support. For example, counseling, post-disasters relief, and we will work with different policy bureau and department, which includes long-term housing as well. We'll continue to monitor the workload of frontline social welfare workers. Depending on the needs of different cases, we will provide different services. For instance, when a case has become more stable, it may not require as frequent support as it used to. And if specific support needs to be provided, we'll definitely keep a close eye on the situation and render sufficient assistance as required. The management of the Social Welfare Department, including the headquarters of the department, will provide adequate support to frontline workers so that they will have peace of mind while rendering assistance to the public. I'll finish quickly. When it comes to resource allocation, we have already done it. We have moved resources around to support the work of our frontline workers. Thank you.
Mr. Chao Xiu-chong. Thank you, Chairman. The government is looking to create this rank of health and care workers. There will be training courses for this rank, and then in the second half of this year, the training program will come on stream. So how's the preparation coming along? How many training organizations are willing to offer the training? I have a second question, and that is, local enrolled nurses have told me, now since nurses were brought in under the skilled professional scheme, local enrolled nurses are struggling to find a job. The imported nurses are paid at $22,000 per month. Now, for our HCPs, they need to be veteran health workers, and then they go through 700 plus hours of training. Health workers are paid $22,000 to $30,000 per month, and these workers take a 700-hour course, and then they have to compete with the imported nurses. Our local health workers will struggle to find work. So my question is, as we consider launching the training program of HCPs and we consider creating HCPs, will these HCPs end up with no job? Now, we now have this 468 requirement in place of the 418 requirement as the continuous employment requirement. This can be a reference for the threshold for the working family allowance. In light of this change to the continuous employment requirement, will we consider changing the threshold for working family allowances? Secretary. The idea about creating the rank of HCPs is to offer a promotion rank for health workers. That is a different concept from our labor import scheme. Jobs go to our local workers first. We bring in nurses because we are short of local nurses. Local workers will always get the jobs first. There are many ambitious health workers. They want to move to the next level, but now there is no such option. So we will offer the training courses to make sure that health workers are up to standard, and we also offer ambitious health workers an option in their promotion. In terms of the working hours required for working allowances, there's a reason we set the threshold. We encourage families to work before they qualify for the allowance. So the working family allowance is distinct and separate from the working family allowance. Mr. Andrew Lam. I want to discuss 2 points raised in the 2025 policy address. First, it's about the AI efficacy enhancement team for the LWB and the SWD. Are there plans or are there measures already underway about optimizing services by using AI to lower costs? My second question is that there's a working group on aging population. I believe the biggest challenge remains for the Labor and Welfare Bureau, even though the working group is supposed to be a cross-departmental effort. I know a report will be submitted to the Chief Executive this year. Will there be an interim report that can be shared with this panel, Secretary? I thank Mr. Andrew Lam for his questions. These 2 working groups are led by the Chief Secretary for Administration, so this question will be better answered by the Deputy Chief Secretary for Administration. I'm not part of the AI efficacy enhancement team, but I am the deputy leader of the working group on aging population. The Labor and Welfare Bureau has submitted ideas to the Deputy Chief Secretary. But as for the specifics on when to announce the results, that will be left to the Deputy Chief Secretary, Mr. Tam Chen Kwok. Thank you. We see enhancements to many welfare facilities, but let's look at New Territories North. Let's look at the daycare centers and support for women. Those services fall short. With the northern metropolis, we expect a population boom in the area. So let's dig deeper into these issues. For me, top of mind for me is bullying among young people. At Queen's Hill in Fanling, there was blackmailing and fighting among young people. And then on New Year's Eve, there was a brawl involving young people in Kwun Tong. We found out about these incidents from online footage. We're worried about young people resorting to violence to resolve differences. And then many people choose to remain as bystanders. That's worrying. So my question is, what plans does the government have to deal with these problems? For violence among young people and bullying, will there be extra measures? Secretary. I thank Mr. Tan for his questions. In New Territories North, which will be part of the northern metropolis, that will be the center of population growth and economic boom. I can assure the member that in social welfare planning, we will duly consider the broader trend that will apply to the New Territories North. We will do everything we can to make sure the social welfare facilities and services are in place. The second question from Mr. Tam has to do with youth work. As Ms. Maggie Leung said, we have many centers for young people. Young people these days are very active online. So we do have services to reach out to young people online instead of trying to reach them in person. I know time is limited. Maybe Ms. Maggie Leung can tell us briefly what we do online. Can we switch on the microphone for Ms. Maggie Leung, please? Thank you, Chairman. As the Secretary said, we do have our cyber support teams. I didn't get a chance to elaborate on these teams a moment ago. Now we have integrated centers for children and youths. Last October, we worked with the sector on a review. We required the sector to coordinate their services, and those services include social workers at schools and also the cyber support teams. We want these teams to work together. We want to strengthen the resilience of primary and secondary school students. We also want to achieve synergy on dealing with issues such as bullying, and we will keep stepping up such efforts. Next, Ms. Jovi Chan. I agree with Mr. Andrew Lam on elderly care. I know the biggest challenge will remain with the LWB. Now you get an extra task ahead of you, and that is the medical fee waiver for fees and charges. I've been helping out seniors with form filling. It's very complicated. The matter falls within not just the Health Bureau, but also the LWB because it goes to the Integrated Family Service Center. I know it's very stressful in those centers. When applicants come to you, even when they have all the supporting documents, the applicants settle for conditional approvals which last 3 months because they want faster approval. In 3 months' time, they will have to come back again for further conditional approval. And we have to explain to these confused applicants who struggle to understand why they only get 3 months only with 3 months. Does that point to inconsistent processes and insufficient manpower? If that is so, can we adjust the arrangements? Now, for the Community Care Fund, there's a fund for people to buy medicine for rare diseases. That scheme started from 2017. Primary evaluation will start this year. Will the data and be consolidated under the CCF and work with the Center for Medical Products Regulation so that we make the drugs more affordable for people? These two questions should go to the Health Bureau. so I am in no position to answer the questions. What I can say is that the SWD does give support in fees and charges for public hospitals. Ms. Maggie Leung can tell us more in a moment. So when it's an applicant with financial needs, the hospital authority will help out. If the applicant is not in financial need, the social welfare department will help out. Ms. Maggie Leung. We have medical social workers who work at the hospitals under the hospital authority. We work with the hospital authority. We help applicants with medical fee waivers. Social workers assess the family conditions of an applicant. I know there are dedicated teams under the hospital authority. These teams deal with cases where the applicant lacks the means, and we will continue to support the HA on this front. Ms. Grace Chan. On community support services, welfare organizations should work closely with care teams. Many frontline workers from social welfare organizations want to establish a more effective partnership with care teams. They also want clearer divisions of labor with care teams. So since we have both the LWB and the HYAB here, so I wonder if the government can coordinate the work of welfare organizations and care teams. Can we have better coordination in terms of what they do? I know this is no easy task. There may be some overlapping in the work done by care teams and welfare organizations. So can we better coordinate the work done by care teams and welfare organizations? Secretary. I thank Ms. Grace Chan for her questions. I think care teams and welfare organizations are doing fairly well in terms of supporting each other. We now use big data to support carers. The Housing Authority shares their big data with us. We get a list from the HA. Some elderly households meet our preliminary conditions, so we get care teams to help us reach out to the seniors. Care teams are not made up of professionals. We give care teams some basic training. The care teams don't have to give the support themselves. They simply refer cases in need to welfare organizations. So that model is working fairly well. This is just what I've seen. In the early days of the current district councils, I visited every single district council. I met with all district councillors. So I linked up district councils with the local welfare organizations. So those district councils have the contact information of those welfare bodies. So with district councils and care teams, they coordinate with each other. We cannot expect care teams to be a jack of all trades, but they reach out to people, they meet with local residents, and when they do come across families with needs, most care teams are aware of who they should reach out to on the side of welfare organizations. Let's see if Ms. Maggie Leung has anything to add. Or rather, Mr. Clarence Low. Care teams are supposed to bring together the resources in the community. So when there are welfare organizations offering services, we are pleased to see that. As Mr. Sun has said, care teams reach out to residents in need. Once we see the need, the care teams refer those cases to professional social workers or welfare organizations. From what I know, many district-level welfare organizations also work closely with district offices. The district officers acting as commanders-in-chief of the local care teams, also coordinate the efforts. So first, we identify who needs the services, and afterwards, we work with the social welfare organizations. The cases are referred to those organizations.
多謝。
Next member, Ms. Jeannie Mann. Thank you. I'd like to follow up on the voucher scheme. The elderly service voucher scheme is for the elderly people to buy necessary facility and equipment. However, there was reportedly abuse of the scheme. Now there will be an addition of 4,000 vouchers. So how is the government going to address the abuse issue? Does the government have any plan to allow elderly people to buy a wider variety of services and products? There are more and more drone technology products, but elderly people may not be able to rent the products that are the most suitable for them. Will they be able to use these vouchers, that is the community care service voucher for the elderly, to buy these products? Secretary, thank you, Ms. Mann. As for the CCSV, it uses the principle of money following the user. It is very popular. If we find there are lawbreakers, we adopt a zero-tolerance approach. Whenever we identify any non-compliance with the rules, of course, we report the case to law enforcement agencies when there are lawbreakers. That said, regarding drone technologies, I'd like to give the floor to the Deputy Director to give you more information. Thank you. Under the CCSV, seniors can use drone technology products. We review the list of products from time to time. With technological improvements, we will review the list and then we will add more products to the list. We do carry out reviews on a regular basis. Thank you. Next member, Mr. Chong Ho Feng. Thank you. I have two questions. One, on protecting children. We saw a case in 2021 where children were abused, and the Roundtable has been asking to install CCTVs to protect children. We want to eliminate any non-reporting of cases. And the children's residential home has been using this device. Is there any possibility of extending the scheme to other homes as well? Next, I'd like to talk about the community living room. The community living rooms are very well equipped with facilities. For the one in Sham Shui Po, at the end of this year, the tenure will come to an end. Are you going to extend the scheme? Will the commercial sector be sponsoring these schemes? 6 community living rooms will be added according to the policy address. Will there be community living rooms added in Yunlong and Tuen Mun? Yunlong is the one of the most SDU heavy areas in Hong Kong. It actually ranks 7th. Mr. Sun, thank you. The first one is in Sham Shui Po. Organizations are willing to keep sponsoring the community living room. On the 28th of December 2023, the first community living room came into operation, and the tenure will come to an end by the end of this year. We have already discussed with the operator, and we will extend the tenure, so rest assured, We'll continue to liaise with the sponsors. Many of them are passionate, but then we need to respect the wishes of the sponsors as well. Regarding the remaining 6 community living rooms, we will announce the location of them very soon, and I believe there won't be just 6. We have undertaken 6 more, but then I believe there will be more than 6. As Mr. Ma Chong said, Tuen Mun, Yuen Long is not easy at all to identify suitable locations. Some organizations are willing to rent suitable venues. As for the remaining 6, they don't cover Yuen Long. It is not the case that we don't want to have one in Yuen Long, but then we haven't yet been able to identify a suitable location. Regarding the installation of CCTVs in children's homes, we are piloting this arrangement, and we will carry out reviews before we discuss it with members in due course. Next, Mr. Hong Kam In. Thank you. Thank you, the 2 bureaus, for their very detailed introductions. We can see a lot of policies that benefit members of the public. Regarding the initiative of 1 social worker per household, we have visited the affected residents of Wang Fok Court. They spoke very highly of this scheme. They thanked social workers. An association in Kwun Tong supports social workers in this scheme. Regarding targeted poverty, the policies this year are indeed very good. Can we extend the policy to kindergartens? The dedicated fund is a good policy as well. Is it possible to increase funding? Can we use AI to enhance efficiency and ease pressure? Regarding the Guangdong scheme, it is a sought-after scheme. For those whose roots are in Fujian, they want to have an extension of the scheme as well. Some members of the public want to feel the different policies of the administration as well. Is it possible to extend the scheme to different categories of people, Mr. Christian? Well, thank you, Mr. Hong, for his questions. He asked 5 questions, very efficient. We are working with different organizations, including district organizations. Regarding the Guangdong scheme, at present, we want to focus on the Guangdong scheme first. The Guangdong province is an expansive area. We do understand that some people under the Fujian scheme want to benefit as well, but at present we want to focus on the Guangdong scheme. We need to sort out priorities when it comes to using money in the public coffers. So we'll have to consult the financial secretary. We first of all make good use of the $500 million. Well, first of all, we want to focus on primary school first, as it is quite complicated to provide such services in kindergartens. So we will first of all focus on primary school for school-based after-school care service scheme. Mr. Stanley Ng. We are willing to take forward the work of the 2 bureaus. I'd like to speak on 3 fronts. 1. As set out in Policy Address 2025, an accident detection system will be installed in 300 households. the use of technology is effective in preventing accidents and tragedies. I'd like to ask the administration, how are you going to implement this policy? In addition to smart detection systems, will you extend the scheme to your own technologies as well? As for the register of high-risk seniors in Hong Kong, we see eye to eye with the government that we need to use the data of different departments and bureaus to set up this register. This register has come on stream for about 6 months. The database is set to be extended to cover 3 new buildings. So I'd like to ask the administration, for the high-risk seniors you can get a hold of, what is the number for high-risk seniors? How are you going to expand this arrangement? My third question was actually mentioned by Mr. Hong. There's a huge demand for the extension of the scheme to Fujian as well, in addition to the Guangdong scheme. Many people want to see such an expansion. Some people ask why you did not cover the Fujian scheme as well. I know you want to enhance the Guangdong scheme at present, but as far as I'm concerned, the quota has been used up under the Guangdong scheme. Secretary, could you please answer in brief? Yes, of course. Well, the quota of the Guangdong scheme hasn't been used up. As long as you're interested, just make an application. We just want to focus on the Guangdong scheme at present. It is available in 8 cities among the 9 cities in GBA. We see the most in Shenzhen and Guangzhou. That is because they want to enjoy medical services in Hong Kong whenever they need to come back. We already have portable cash assistance for Fujian scheme, and I believe the residential care homes are of very high quality. But one main concern among seniors is the medical needs. If they need to come back to Hong Kong for medical attention, how can they do so? For those who stay in residential care homes in mainland China, they're above the age of 80. That's exactly why medical attention is one factor that they take into account. Rest assured, for the 300 household pilot arrangement, we will review it, and we will also explain to to members if need be. Next, Ms. Elaine Check. Thank you. The Residential Care Homes Legislation Miscellaneous Amendments Ordinance 2023 is being implemented by phases. Hundreds of residential care homes don't meet the requirements for area per resident, and some residential care homes are forced to fold up. I'd like to know how many residential care homes will not be able to meet the requirements in June this year. Do you have any arrangements to help the sector to tide over this difficult time? Just now we talked about the school-based after-school care service scheme. It helps teachers as well as parents. Some schools are afraid of being labeled as a school for the disadvantaged. There is just one primary school taking part in the scheme in the Wan Chai district. For the Eastern District, 2 out of 27 take part in the scheme. As I understand, there won't be any cap on the quota. Are there any new schools that take part in this program? What is the reason why some schools do not take part in the program? What plans do you have to encourage schools to take part in the scheme so that they can make good use of the resources of the scheme? Thank you.
Secretary. The after-school school-based scheme is all positives, and we are trying to promote this scheme among more schools. And we want all kinds of schools to take part. Doesn't matter if they are prestigious schools or not. Now, on the question about the amendment to the residential care homes ordinance, that question has to do with the details, and I'll see if my colleague, Ms. Khan, has anything to say about this. Now, that bill was gazetted on the 16th of June 2023. Home operators get reasonable time to prepare their manpower. On June 16th this year, starting from this June, you will need 1 nurse for every 60 residents or 1 health worker for every 30 residents starting from June this year, and that shift will go up from 11 hours to 13 hours. Mr. Bill Tang. Another member raised a question about the future of community living rooms. The member would like to see the scheme to continue until its mission is completed. In 4 years' time, the Basic Housing Unit Ordinance will take full effect. At that point, we will get basic housing units and bed space apartments. You will still have grassrooters staying in very cramped flats. Basic housing units are only 8 square feet, and that's very crowded for a family of 3. So community living rooms will still be needed in areas where you have clusters of basic housing units and bed space apartments. Do we have a policy to regularize community living rooms? Of course, the funding model can be considered. Community nannies and food banks took a long time before they were regularized. So for community living rooms, I think even when we have BHUs in place of SDUs, we will still need community living rooms. Now for the register of at-risk seniors, I may take a simplistic view of the matter, but I would like to hear from the Secretary about this. We have covered housing society flats and 3 new buildings. Why not cover other buildings? As long as seniors are on welfare, we should have information on them. So why can we not cover the seniors living in TPS flats and HUS flats? That would make it easier for care teams to reach out to those seniors. Secretary. For community living rooms, the funding happens through the Community Care Fund. As Mr. Clarence Leung said, we take this approach because community living rooms are a trial scheme. There are 20-plus trial schemes under the CCF. One of them is the community living rooms. CLRs are a tripartite collaboration. You have businesses, the community, and the government involved. It's very flexible. Community living rooms may be set up in different districts. With that flexibility, we can provide extended living space for people in need. On the register of at-risk seniors, we're not saying we will stop after we are done with the 3 new buildings. We can start with HA, meaning public rental housing, and 3 new buildings. We will get to the other buildings later. Mr. Chen Pui-Kong. Thank you, Chairman. I declare an interest. I'm a member of the care team in Sao Mau Ping Central in Kwun Tong. Before this meeting, I took part in a project in looking after seniors. I had a chat with the seniors. They were happy. I commend this scheme because this scheme truly helps people. Can we raise the funding level for the scheme? For each ward, there are roughly there's $200,000 per year in funding, and there's only that much you can do with that sum. So can we have more funding for care teams? As the secretary said, care team members are very passionate people. They want to help. Now, on the term, I heard 3 years for the scheme. Can we align the 3-year scheme with the term of the care teams? Otherwise, you find yourself in an embarrassing spot. So a team undertakes the scheme, but the care team may only operate for 2 years. So say their previous term ends in September. The old care team may not get the new term of the service, but the old care team gets the assistance of the support for carer scheme, and that's an awkward spot to be in. So if at all possible, can we align the term of the support scheme and the term of the care team? Secretary. I think there's a way to solve it. We want clarity and simplicity. That's why we prefer terms. Let's see if my colleagues have an answer to this. On the funding amount, that funding is to supplement the operation of care teams. But we're happy to look at whether there's room for further enhancing the funding. We want to offer the funding as a token of appreciation. Ms. Megillar. Mr. Chung made a good point. Starting from 2026 to 27, there will be a 3-year scheme. We have talked to the Home Affairs Department. There will be 2 stages in this 3-year window. So stage 1, it will be 18 months. That will be aligned with the term of the care team. We do want continuity over the 3-year term. We don't want people to find the term too short. That's why there will be a 3-year term. There were isolated cases where halfway through the scheme, a different care team took over. So we will deal with that. I do thank Mr. Chen for his reminder. Once again, I thank the 2 bureaus and their officials for joining us on this detailed briefing and answering our questions. If there is no other business, I adjourn the meeting here. Thank you.
主席真係好人士，主席梗係梗係好啦。